Good day everyone, my name is Ronalyn P. Madlangbayan, a student nurse from San Sebastian College, Recoletos de Cavite. And today I am going to perform the vital signs monitoring and recording. Vital signs must be accurately measured because they indicate the body essentials, functions, and it also acts as a baseline data set that allows us to track the changes in a patient's status, detect early deteriorations, and avoid any potential injury or error. In assessing the patient's vital signs, we need to know how to measure the body function of our client by the use of four main vital signs. So the four main vital signs are the body temperature. So we must know the normal body temperature or clinical signs of fever, and also know hypothermia, and the next is pulse rate. So in pulse rate, we must know the measurement of the heart rate, or the number of times the heart beats per minute of our patients, and know if has cardiovascular alterations such as hypertension and the heart rhythm or volume. And the next is respiration rate. So in respiration rate, we must observe the client chest movement. And lastly, the blood pressure. In line with that, we know the patients is experiencing hypertension or hypotension, and that affects blood pressure. Now you know the importance of vital signs, and today I'm going to show you the paraphernalia needed. The first one, digital auxiliary thermometer. So to use this is to measure the body temperature. And the next is sphygmomanometer and also a stethoscope. So to use this is to measure the patient's blood pressure. And the next one is alcohol to avoid infections and contamination. And cotton balls. So to use this is to clean the earpiece of my stethoscope, and to use a clean to stem and bulb of the thermometer. And of course, don't forget the clipboard to check the documentations of the patients or the medical record of the client. Come in. Prior to conduct this procedure, I am going to close the door and close the curtains. To ensure my patient's comfort and privacy. After to ensure my patient's and comfort privacy, I'm going to hand hygiene. After that, I'm going to introduce myself to my patients. Good morning, ma'am. I am Ronalyn Madlangbayan, your student nurse. So, may I know what is your name po?
My name is Damasco.
Okay. How old are you na po?
19 years old.
When is your birthday po?
January 15, 2000.
And where do you live po?
I live in General Trias, Cavite.
Okay, thank you, ma'am. Now, it's okay to you if I take your vital signs?
It's okay.
Alright. May I know how are you feeling po for today?
I'm fine. I just want to know the state of my body.
Okay po. So, ma'am, for today, I'll be checking your vital signs. So, your vital signs po, it's crucial po for us to know if you're having troubles with your health or if you're in perfect health. So now, the vital signs consist of 4 factors, which are the body temperature, pulse rate, respiration rate, and blood pressure.
Ano po yung uunahin natin doon?
So ma'am, to begin, I'm going to take your body temperature. Body temperature is significant because it reflects the body's balance of heat production and heat loss. So there are a few places where we can place the body temperature. So which are the temporal, the mouth, the rectal, the axillary, and the tympanic membrane. So now I'm going to measure my patient's body temperature through her axillary only. Okay, ma'am, I'm going to measure your body temperature, and I'm going to put the digital thermometer in your axillary side or under your armpit. So ma'am, I'm gonna have to pull your sleeve so that I can put the digital thermometer. It's okay with you, ma'am?
It's okay.
Okay. So, before putting the digital thermometer in the patient, we must disinfect it first or wipe it first with alcoholized with cotton ball. So now I'm gonna disinfect the digital thermometer. Disinfect the digital thermometer, we need to start to bulb. Start to bulb to stem. After the disinfect the digital thermometer, I'm going to do is to take a look if the area have scars or lesions, and pat dry if the area is wet or moist. Kindly please raise your hands for me. Okay, and I'm gonna pull up your sleeves. Is okay with you?
It's okay.
Okay. I'm gonna pull up your sleeves na po . So as I can see, the area is clean. So ma'am, since the area is clean, I'm gonna put the digital thermometer to your axillary. So we're gonna have to wait for a few minutes, and then when the thermometer is beep, so that indicates that is already obtained the body temperature. The thermometer is beep. So I'm gonna pull down your sleeves, ma'am. So your body temperature is 36.1 degrees Celsius, which is indicate in the normal range. So before the thermometer placing it, we need to disinfect it again. So we're gonna disinfect the digital thermometer from stem to bulb. It is important to disinfect the thermometer to avoid contamination. And placing it. And record the document data from the patients in TPR sheet. So after the assessing the body temperature or the auxiliary temperature of the patient, the next thing we do is to proceed the tympanic temperature. So before that, before to proceed the tympanic temperature, we need to perform first the hand hygiene. Alright, in the procedure of the tympanic temperature, the first thing we do is to identify the patient or client, if the patient is child or if the patient is adult. So if the patient is adult, the procedure we do is to attach the tympanic probe first, covering and gently, and then pull the patient's pinna up and back, and to strengthen the ear canal. So, if the client is child, the thing that we do is pull the patient's pinna, strengthen back to downward. After that, insert the thermometer into the ear opening and open the activation button. So, for 1 second. And then, wait for the beep until the between out, and then after the beep you hear, so record the body temperature and remove the probe cover of the lens because it's disposable, and perform again hand hygiene. And now I'm going to proceed to taking my patient's pulse rate. So the pulse is a way of blood forms by the heart left ventricle contracting in order to me to measure it. So I'll be palpating of both sides of her body, which includes the temporal, carotid, brachial, radial, femoral, popliteal, and posterolateral. However, today I'll be palpating her radial because it's the simplest and most accessible pulse site. Okay, ma'am, I'm gonna measure your pulse rate. It's okay with you?
Yes, nurse. It's okay.
Okay. Okay, it is important to know, aside from the number of beats per minute, I also need to check the strength of her pulse, which is rated 0 to 3 plus scale. So 0 is being the pulse is absent, 1 pulse if it's weak, and 2 pulse for normal, and 3 is if it's bounding, and of course I need to check the rhythm if irregular or regular. Okay, So I have obtained my patient's pulse rate. Okay, ma'am, your pulse rate is 68 beats per minute and it's graded 2, which is normal, and it has a regular reading. After taking the pulse rate of my patients, I have to perform the hand hygiene. And document the data I have gathered in the TPR patient's sheet. So after doing the procedure, I can now proceed to taking my patient respiration rate without removing my hand to her radial artery and just observe the rise and fall of her chest, so as to not make the patient's conscious and easy, because it can alter her breathing, and this method is also gives much more accurate result for her respiration rate. Okay, now I'm going to proceed to taking my patient's respiration rate. Okay, ma'am, I'm going to proceed to taking your respiration rate. So I just need to be you ease and relax. So for taking my patient's respiration rate, I am not just simply taking the number of beats per minute, but also the depth of her breathing, if it's labored or unlabored, and the rhythm also to determine if the rhythm is regular or regular, and of course her character. It is important to know that one rise and one fall of the chest will be equivalent one respiration rate. Okay, ma'am, I'm going to take your respiration rate. It's okay with you?
So,
Okay, ma'am, I just need to put your hand here and just relax and breathe. Okay? Okay, ma'am, the number of your respiration rate is at 18 beats per minute, and it has a regular rhythm and a label. Okay, now just to perform again another hand hygiene. And document the data that I have gathered in my patient's TPR sheets. And now I'm going to measure the fourth vital signs, which is the blood pressure. So prior to conduct this procedure, I have thoroughly checked my equipment if they are clean and well functioning. And I also have a correct size of cup for my patient need. Okay, ma'am, before I take your blood pressure, may I ask if you have any arterial venous fistula that may hinder me to taking your blood pressure in a particular limb? Okay, so have you taken or have you smoked or taken caffeine for the last 30 minutes? Okay. So now, since my patient is already answered, now I need place the cuff or on her arm. Okay, ma'am. Can you put your arm here? And it's okay with you if I'm gonna pull your sleeves?
It's okay.
Okay, thank you, ma'am. Can you move here, ma'am? Alright. Alright, since the cuff is already fixed and now I need to locate her brachial artery using my 2 fingers. Alright, since I have found her brachial artery, I'm gonna start inflating the cuff until I no longer feel her brachial artery. Okay, I'll start now, ma'am. Okay, now I have taken her brachial artery. I'm gonna deflate the cuff. I have now taken her estimated systolic pressure, which is 101 millimeters of mercury. I'm gonna deflate the cuff, ma'am. Since this is my patient's initial examinations, now I'm gonna do the procedure again or on her other arm. So for the actual taking the blood pressure, I gonna need the inflate the cuff about 30 millimeters of mercury, higher than estimated systolic pressure. For the actual procedure, I gonna need to my stethoscope. So before that, I gonna disinfect my stethoscope, the earpieces of my stethoscope using the alcoholized cotton ball. Also the bell of my stethoscope. Once I have found her brachial artery, I'm gonna start to inflate the cuff about 140 millimeters per mercury. Okay, now I fully deflate the cuff. So the first sound that I have heard will be the systolic pressure, and the diastolic pressure will be the period of the silence. After that, I have heard that the last sound. Okay, ma'am, I'm gonna remove the cuff. I'm gonna pull down your sleeves. So ma'am, your blood pressure is
122/80, which is in the normal range.
okay. Now I already have her blood pressure, so I'm gonna fully deplete the cup and disinfect it to reduce the risk and the cross contamination. And of course, I'm gonna do the perform hand hygiene. And document the data that I have gathered in my patient's PPR sheets. Okay, that would be all for my return demonstration in obtaining vital signs. Again, this is Ronalyn Madlang Bayan, BSN 1A. Thank you for watching.